Hey guys, it's Dr. Alicia here from She Found Health. I just wanted to do a quick update on COVID-19 and newborns and how can we protect our newborns during this time of coronavirus and COVID-19. So today we're going to talk about how to protect your newborn leading up to delivery, how to protect your newborn after delivery, including self-isolation, hand hygiene, and we're going to talk about breastfeeding your newborn as well. So if you think this is a useful topic, if you like these types of topics, please subscribe below. Also check out our website at www.shefoundhealth.ca and make sure you read the disclaimers below as well. So let's do a quick review on what we know about COVID-19 in pregnancy and in newborn care. We certainly have some new numbers. We're up to about 113, 115 deliveries and newborn babies that we can get some information out of. That's out of China and out of New York as well. Not all of that has been compiled into scientific studies, but at least we have a little bit more information. So from what we know, we still don't think that COVID-19 poses an increased risk to pregnancies. So just because you're pregnant does not mean that you have an increased risk of getting COVID-19 or of having worse outcomes because of COVID-19. This is very different from influenza, which we know women who are pregnant are at a higher risk of getting, and outcomes are often worse, and same as the newborn. We don't think that newborns are at a tremendously increased risk of getting COVID-19 or of having bad outcomes, which is great. What we are seeing is there's an increased risk of preterm delivery, we think, with COVID-19, and as a result, babies are needing more support because of the preterm delivery piece as opposed to the COVID-19. So what can we do to help protect ourselves and our babies? So the first thing is what we should all be doing, and this is more than social distancing. This is kind of self-isolation or self-quarantining as much as you possibly can. So what does this look like? This looks like only going out for true necessities. So going out to the grocery store as infrequently as possible. So say getting a big grocery shop every 2 to 3 weeks if you can't get it delivered or can't get somebody else to pick it up and drop it off for you. When you go out, good hand hygiene, so sanitizing your hands, grocery carts, before and after, making sure the moment you come in, you give your hands a good wash with soap and water for 20 seconds. Same goes for your partner. So anybody who's going to be in the house with your newborn should be self-isolating together and avoiding any contact that's unnecessary to anyone outside of the home. So some of us have to work. And if that's the case, best things to do is wiping down surfaces at work, making sure you're washing your hands frequently. When you come home, take off your clothes, put them in the laundry, give all of your exposed areas, so face, hands, a good wash with soap and water. I personally, because I'm in the hospitals, I come home and I have a shower, wash my hair before I even see my kids. I come in a separate entrance. Now, I'm at a bit of a higher risk because I'm in and out of the hospitals and because I'm seeing patients. But for most people with a regular type of job, probably just putting your clothes in the washer and washing your hands, washing your exposed areas with soap and water is sufficient. So partners, if you're out working or if you're pregnant and needing to work, this would be a great idea for yourself as well, just to decrease the risk of that virus being brought into our homes, because we know it can live on surfaces for up to 2 days. So we need to be cautious about what we're touching when we're coming in, because if we have yet to touch our eyes or our nose or our mouth with our hands, but we've got the bacteria on our hands, we can then spread it throughout the house and then touch it later and touch our eyes and nose because we think we're in a safe place. So the same goes for anybody else who you think you really need present for support postpartum. So if you think you need your mom to come in and help you out, then they should be self-isolating, and your mom and anybody in their house needs to be self-isolating. It does no good if only one person is self-isolating if somebody else is coming in and out of the house. So I know a lot of our pregnant moms right now are really struggling because their parents aren't self-isolating. So they're making the decision that their parents can't come visit their newborn babies after they're delivered. And this is going to have a huge impact, but I think it's really important to keep us and our babies and our communities safe, is really enforcing that if you haven't been self-isolating, you should not be coming to visit afterwards. And we'll talk a little bit more about that. The other thing that we need to remember is when we're going into the hospital for delivery, we're bringing in anybody's germs that we've been in contact with. So if our partner hasn't been self-isolating, they're potentially bringing in germs into the delivery room, which is putting our healthcare workers at risk, which is why most hospitals have only one support person in labor policy, and that person cannot come in and out of the hospital during labor. If they come in, they're there, and if they have any symptoms, they're being asked to leave, because we need to protect the other moms and babes on the ward, and we need to protect our healthcare workers so that we can continue to provide care to our pregnant and laboring moms and to other patients in the hospital as well. So self-isolation, we suggest starting at 36 weeks. You don't know when you're going to go into labor. If you have a booked cesarean section, you could start 14 days prior to that, and that would be reasonable as long as you don't go into labor before. But if you're planning on having a vaginal delivery and you don't know when you're going to go into labor, we'd advise starting to self-isolate around 36 weeks to decrease the risk that you're going to be symptomatic during delivery, thereby exposing your newborn baby to COVID-19 or exposing others in the room to COVID-19. In terms of postpartum, how long this is going to last, we don't know. So making sure that you have your Zoom or your FaceTime all set up so that you can have contact with your support people and your loved people. And we're happy if you want to Zoom or FaceTime during the delivery in the labor room. We're happy to support that as best we can. Some situations may not be appropriate, so certainly ask before you're going to. But if you want to have conversations with your loved ones at home, then that's totally fine to do that. So the next topic I want to talk about is hand hygiene. Now, we talk about this a lot, but it's so important. Washing your hands with soap and water for 20 seconds will get rid of COVID-19 and many other bacteria. So this is just good practice in pregnancy, in breastfeeding, in newborn care, period, end of story. We want to decrease the risk of transmitting any bugs to our baby, because we, during postpartum and our newborn babies, are at the highest risk we are at most of our life for getting viruses or bacterial infections. And so we want to decrease that risk regardless of COVID-19 or not. So good hand washing is so important. Anybody who you choose to have come over to your house, and that's your choice, how much risk you're willing to accept, should be washing their hands when they come into the house and before they touch your baby, and presumably after they leave your house as well. The other thing is, if you do need to go out and about for whatever reason, making sure that you're doing good hand hygiene when you're out and about, using sanitizer. If you're carrying your baby bucket, make sure you're sanitizing the handle of the baby bucket or the stroller, the buggy. And it's okay to go out for walks, but don't go out for walks with friends. We need to be out, that's all that part of self-isolation. So go out for walks with your partner, whoever you've been self-isolating with, but don't go out for walks with friends and walk 2 feet away from them, because that defeats the purpose. So the other question a lot of women have is, can I still breastfeed? And yes, 100% you can still breastfeed. If you're asymptomatic, please breastfeed, but follow proper precautions. Hand hygiene before touching your baby, before breastfeeding, because we know that we can actually start shedding viruses a day or two before we become symptomatic from COVID-19. So just having good hand washing hygiene in place right from the start is really, really important. If you do become symptomatic, and the symptoms can be very mild, we're talking maybe a bit of a headache and feeling a little bit unwell, or having a bit of a cough or a bit of a fever. Most people are going to have very mild symptoms, which is part of the problem. We don't realize we're symptomatic until it's too late and we've already spread it to other people. If you are having symptoms, you can do one of two things. You can continue to breastfeed with good hand hygiene, perhaps washing down your nipples with soap and water before you breastfeed, and wearing a mask so that if you do cough or you're in close contact with your baby, you're not breathing the virus onto them. So that is certainly one option. The other option would be to use a pump to express breast milk under good hygienic standards. So good hand washing, have everything sterilized, wipe your breast down with soap and water before you use it, and then having your partner do all the baby caring, including the feeding of the baby. Now, we think to the best of our knowledge that after 3 days of being asymptomatic, we're not really transmitting much virus anymore. So if you are having significant symptoms, then certainly self-isolate for up to 72 hours after being symptom-free, and then you can go back to caring for your baby. So to recap the breastfeeding, yes, please continue breastfeeding. If you have symptoms, follow good hygiene protocols. And if you are worried about exposing your baby significantly, then have your partner do all of the baby care. And while you're pumping, you have a mask on, you have good hand hygiene, breast hygiene, and your partner can give the baby express breast milk. So we're wondering, how are you doing with self-isolation? Please put some comments below. It's such a challenging time for all of us, and especially when this should be a really joyous time in our life. So we want to know how you're doing. What are some tips and tricks that you've found? Are you Zooming with people? How are you connecting with your loved ones and your support system? So that's it for today. Basic tenets are: know the symptoms of COVID-19. So those can be very mild, most commonly starting off with a little bit of a headache, fever, cough. Some people are having diarrhea. Those are our main symptoms. If you're having symptoms like that, self-quarantine, Good hygiene, try not to spread it around. Number 2, self-isolate. Keep yourself safe. Don't let yourself be exposed before your delivery or when you have a newborn. Number 3, practice good hand hygiene. And like I said before, this is important regardless of the situation we're in because there's always viruses and bacteria around. So you and your baby at your most susceptible time during that newborn phase. So be very cautious and make everybody around you practice good hand hygiene as well. And number 4, breastfeed, breastfeed, breastfeed. If you choose to breastfeed, it's fine to continue. If you're symptomatic, modify how you're doing that to keep your baby as safe as possible. If you choose to formula feed, then continue to do that as well. That's totally fine. If you're symptomatic, your partner can do all of the baby care and the formula feeding on their own. So if you found this useful, we'd love it if you subscribe below. Check us out on Facebook and on Instagram at she.found.health. And here's a couple other videos around the postpartum period you might find useful.